Hello and welcome everyone. This is Jessica from QRSMA's Community Support Department, and we're so glad to have you join us for today's physical therapy webinar series on exercise at home for the walker. Thank you so much to our presenting sponsor, Biogen, for generously supporting this physical therapy webinar series. And we appreciate all the questions we received in advance of this webinar, and we'll try to answer as many of these as we can during the presentation and Q&A. You're also able to submit questions throughout the webinar using the questions box, and you can find that located in your GoToWebinar toolbar. Please note that all lines will remain muted during the webinar other than for the speakers. And if you have any additional questions after the presentation, you can always reach out to QRSMA's community support team at communitysupport@qrsma.org. And now we would like to welcome our speakers, physical therapist Leslie Nelson with UT Southwestern and Tina Duong with Stanford University, and they'll be sharing their interactive presentation, Exercises at Home for the Walker. Welcome, Leslie and Tina.
Thank you so much, and welcome to everyone that's joining. Tina and I are happy to be with you guys today, and hopefully we can help answer some questions that you may have about exercise and just anything that may be on your mind. But I think that this is something that we've used before and talked about before, as far as if exercise could be packaged into a pill, it would be the single most widely prescribed and beneficial medication in the nation. And I find that I think that all of us feel like it would be an easy fix if it was a pill, because exercise is sometimes hard, even if you don't exactly know what to do. Just finding the time and the motivation, even sometimes, to go into exercise can be difficult. But hopefully we'll be able to give you some insight and get you a little bit excited about how you might be able to exercise in different ways. The other thing about exercise is really, thinking through how children are introduced to fitness and are exposed to fitness. That kind of is a good marker for their future health. So children that are more sedentary early on in life really do grow up to have more issues with the potential for risk for diabetes, heart disease, and then pain as well, being overweight or obesity, and even cancer as well. And so overall, getting started as early as possible just leads to good habits and health. So like I said, we hope to give you some insight into exercise and give you a little bit of a guideline to exercise, how we can help you understand how you might support just an active lifestyle and just feasible home exercise programs for those of you that are attending the talk today. When we think about exercise, we're not only talking about exercise in general, but those of you with SMA, and now we're adding into the fact that you may be taking disease-modifying therapies, which may allow you to potentially improve in your strength or your function, and even acquire new motor milestones that we wouldn't have considered that would be a possibility before. And so what that has meant is that we really do need some more data on how exercise may affect disease trajectory, not through just natural history, but now with those of you that are on disease-modifying therapies. But also for those of you that are not on different treatments, we still need to understand how exercise can affect and help you promote your function and also manage possible decline that you may have. We would like to start by saying that really you do need to, before you start any exercise program, refer to your healthcare professionals, as far as your physical therapist that you work with, your neurologist, and even cardiologist if you have one, just to ensure that there are no risks from an exercise intolerance standpoint. And when we think about exercise, we want you to really understand that it's kind of a combination of flexibility, so doing some stretching and maintaining your range of motion, working on endurance, and then working on strength. And we'll talk a little bit about what we mean by the difference between strength and endurance as we get further into the talk. So stretching and low resistance kind of strengthening is probably what we know best from the literature that we have thus far, and how it might impact you. You also want to make sure that you avoid overwork or over fatigue. Obviously, you want to work enough when you exercise to exert yourself and to have benefits from the exercise, but you do need to be cautious in the fact that you probably, as a person with SMA, fatigue fairly easily and have some limited endurance. And so if you get to the point where you work to a point where you can no longer perform your regular daily activities that later that day or even the next day, that's a sign that you really do need to back off a bit. And again, what we do know from literature is that exercise in moderation is safe and can be moderately effective. When we think about how you would rate that, you can use what we call a Borg or an Omni scale, and I have a slide of that in a minute that will talk a little bit about how you determine how much is enough to work. You also need to personalize your exercise program. Tina and I will list a lot of different things that you could try, but some of these things may be too difficult for some of you, and some of them may be way too easy for some of you. Also, starting out, you need to think about how much have I been active prior to starting an exercise program. If you've not done anything at all, then that's going to impact where you can start. And then exercise is not a static prescription. Even if it was a pill, it would be something that we would change and modify as you start to have results from the exercise. So as you work on endurance, then you need to continue to challenge that. And so you have to modify your exercise program as needed. We'll talk a little bit about the FIT principle, and what we're talking about there is how you can look at exercise looking at different program requirements, including how frequently you exercise, the intensity at which you work, and again, we can use that Borg scale or a rate of perceived exertion. How tired do you feel you are either during the exercise or after the exercise? The other way you can measure intensity is how hard your heart is working. And so you can actually calculate a heart rate maximum and kind of determine where a target would be in which you would want to work at. Also, describing or kind of understanding the time the time that you're exercising. So how long of an exercise routine are you doing on that particular day? And then what are you working on? What type of exercise are you really working on? Is it endurance or is it strength? We do have some guidelines from our standard of care document that was published in 2018, and this was an updated standard of care that did go into a little bit more detail about frequency of using different things for exercise. One thing that the standards of care looked at were the use of orthotics. So if you do use braces for posture or even for function, whether you need it for standing or walking, different or range of motion, flexibility type of things, really the minimum frequency for using those braces would be 5 times a week. And optimally, we would hope you were using them 7 days a week. Stretching really depends on what you need as a person as far as the duration, depending on where your specific needs are. But based on the standards of care, kind of the frequency of 2 to 3 times a week would be minimal. Again, optimally 3 to 5 times a week doing your stretching program would be ideal. And then we think about function and strength and how you might work on that. Aerobic and general conditioning is recommended. And you can do different things such as swimming or even walking. Even walking in water can be something that you can kind of throw in waist deep water. Cycling, whether that be on an assisted bike or a stationary bicycle. And then things like yoga can really incorporate some of that flexibility and stability to work on strength. Hippotherapy, rowing, different as far as an exercise, and then even elliptical or cross trainers can be used for some of your aerobic and general conditioning. We would hope that, again, like I said, you want to kind of refer to your healthcare provider, and so really talking with your physical therapist or your occupational therapist that you work with would be beneficial to make sure that you're getting the best start to your program. For aerobic exercise, the optimal duration of how you would work would be at least 30 minutes. that doesn't necessarily always have to be all at the same time. So if you can't tolerate 30 minutes all in one setting, breaking that up within the day can be another option. And then the standards of care also recommend some form of balance exercise for patients with SMA that are walkers. And so we'll talk a little bit about that as well. This is just a slide to just kind of give you a general overview of what are the recommendations for exercise. And when we talk about strengthening, minimally two times a week would be great. Optimally, if you could work 3 to 5 times a week on strengthening. But the thing about strengthening that I think we would want you to understand is that it really would be good to work on those days non-consecutively, meaning if I'm going to work on strengthening my biceps today, I don't want to also work on my biceps tomorrow. I want to give those muscles a couple of days of rest before I work them and challenge them again. And you work around a weight or a resistance in which you could do about 15 repetitions of that exercise and complete 2 sets of those. And then for aerobic exercise, again, the 30-minute session per day, around 5 times a week, up to 150 minutes a week is really what would be optimal. You may not be able to start out with that if you're starting out with an exercise program. It's all about building up to that. And so don't worry if you're not there at this point in time. That's just a goal that you're kind of looking toward. Okay. This is a recent article that was published by Tina and my friend Kristen Kroschel from Chicago. And the reason I wanted to put this in is it was interesting to me. This was a Delphi study in which they looked at therapists that are currently treating patients with SMA and really kind of wanted to look at a comparison of what the standards of care said and what we're actually doing. But this was a nice kind of chart or graph that showed us really when it came to barriers of exercise. I think that you all as people with SMA or as caregivers with patients with SMA understand far greater than Tina and I do what the kind of the impact that resources has on your ability to exercise. So whether a resource be the equipment itself that you need or the time that you need to complete that home program, it can be challenging. And so I do want to kind of put that out there that she and I are talking about, this is what you can do, and that's not always the easiest thing. And so we understand that challenge. But the other thing that I love about this is that the facilitation that occurs is from parent and caregiver support. That's the biggest facilitator, and the fact that you guys have great families and great caregivers can be beneficial. From an exercise standpoint for patients with SMA that are able to walk, really your rehab goals would be to hopefully prevent contractures or scoliosis, and then also to maintain, restore, and promote function. So I mentioned that aerobic exercise, you could do a lot of different things from swimming to walking, all of those different things that I've already mentioned. Also mentioned that balance exercises would be important. And then when we talk about strengthening, you may think about different muscle groups that are a little bit weaker. And if you cannot work against gravity, if you can't lift something against gravity in a way that is with good form, maybe you have to compensate or work that muscle in a different way, then you want to consider doing what we would call gravity eliminated strengthening for those muscle groups. And so you just change your position. So it might be that if you wanted to work on lifting your knee toward the ceiling, so you're working on your hip flexion strength. If that's difficult for you in a sitting or standing posture, try it lying on your side and maybe add some resistance inside lying. And so now you're working without the effects of gravity, but still being able to focus on those muscle groups. The other thing is that we're going to talk a little bit about different types of strengthening. Oh, sorry. Concentric and eccentric strengthening are different ways to work a muscle. Eccentric strengthening can be a little bit more fatiguing, I guess, in a sense, and can be a little bit more difficult sometimes for muscles that are weak. And that's really what you're doing, is when you're lengthening the muscle when you're working it instead of shortening the muscle. So if I wanted to work on my bicep when I'm a concentric exercise, I would be bending my elbow, bringing my hand towards my shoulder. Eccentric would be working it as I'm extending or straightening my elbow and lowering it. These are those scales that I mentioned, the Borg scale, the Omni scale, and it just gives you an idea. You know, for children, sometimes it's a matter of the picture determining how tired you really are, either while you're doing the exercise or after you've completed the exercise. On a Borg scale, really what we would say is this moderate exercise of a rating of 5 to 6 is where you would want to shoot for as far as your intensity. That correlates to about a 64 to 76% heart rate max. And the other thing I'll say is that the way you can kind of, you rate that perceived exertion is that if you're able to talk, okay, but it's not, but you would have difficulty singing a song. So maybe you can talk and you might be able to get through a few words, but maybe it's difficult to finish a long sentence. That's kind of where you might want to focus and be from a moderate intensity standpoint. So again, we've already talked a little bit about this. When we think about exercise, we can talk about endurance or cardiovascular training. We can talk about, or we can talk about strength training. And in theory, what we're really thinking about there is that more endurance training is looking at lower resistance with more repetitions, versus strength training is higher resistance. It's harder to do, but you do less of the repetitions. And then not forgetting that we need to also incorporate flexibility and stretching into your program. Again, we've shown options for different aerobic exercise, just depending on what you have available, whether that be swimming, walking, whether that be on a treadmill or over ground, or even in a body weight supported kind of system. Cycling, whether that's assisted, recumbent bike, or stationary bikes. And again, the list that we've kind of already talked about. Using assistive technology or orthotics or devices as you need to help assist you in what your goals are. So if you need support through your joints, whether that be through your ankle or your knee, or even your spine, maybe you need a thoracic kind of stability, that may help with being able to do more from an assistance standpoint. So using that as you need to. And then working on kind of core or proximal stabilization and endurance is something that we also want to touch on today. I already mentioned concentric and eccentric strength. The other strength that we can talk about is what we call isometric strengthening. And isometric strengthening is a really nice way to kind of initiate a strengthening program. So if you've got muscles that are really have difficulty moving against gravity, in a concentric or eccentric way, or really in any kind of sense, sometimes isometric strengthening is something that will wake muscles up a bit. And so really, if you think about, you're kind of pushing against something, so you're activating the muscle, but you're not actually moving in any way. It can help with stabilization, but also understanding that you do need to think about your stabilization when you're performing exercises. So if you're trying to work on your bicep strength, but you're having difficulty maintaining a sitting posture just because you're fatigued and your trunk is tired from the long day of work or school, then you may need to think about the fact that I'm going to have a harder time working on that arm strength if I'm having to focus so much on stabilizing my shoulder or my trunk. And then also be aware of compensation. So you all are, we're all masters of compensating to make things easier on our muscles. Our bodies are way smarter than we are. And if it's hard for me to lift my leg, I'm going to find a way around it. I'm going to compensate in some way. But when you're exercising, you want to minimize that compensation. You want to make sure that you're really focusing on the true action of the muscle that you're working, so that you can build it up and make it stronger. So then therefore you don't need to compensate to do that action. And so being aware of that's important. We've already talked a little bit about going into a gravity eliminated position for weaker muscle groups. And then the other thing I hadn't mentioned was this assisted range of motion. So potentially, maybe you can lift halfway through some of your available range of motion against gravity, but you might need a little bit of assistance to go through the rest of your range. And so things like pulley systems or active help from another person, different things can be used to help with strengthening through your full range of motion, even if you can't lift through it yourself. And then I would also say that exercise doesn't have to be work. Exercise can be fun and really should be fun. I mean, we're talking a little bit about kids here and that playing is exercising, but that same thing applies to adults. If you don't enjoy what you're doing, then you're not going to be consistent with it and really want to go out and exercise. So think about it and find ways to make it fun, make it play. If you need to do some stretching or work on flexibility, prolonged positioning while you're watching a television program or a movie or playing a game, you can kind of do positions, for instance, if your hips are tight, your hip flexors are tight, lying on your stomach propped on elbows for a few minutes can be a really great way to stretch out the front of your hips. Playing from a standpoint of, especially with kids, if you've got items that they want, put them just out of reach to make them have to reach a little bit further and challenge their trunk strength or balance, or make them crawl a little bit further than they typically would. Wedges or different types of pillows can be really helpful, especially for that prolonged positioning or for other propping and positioning as needed to help maybe give that stabilization in the proximal area when you're working on distal or upper extremity or lower extremity strength. And then sitting on various surfaces to work on trunk control. And one of those great surfaces are the great balls that you guys were provided by Cure SMA. And so we'll talk a little bit about that. But if you don't have the large therapy ball like you guys have, even sitting on a pillow versus sitting on a really nice level surface can make you work a little bit harder. And I'd also like to remind you that adaptive sports can be really beneficial, whether it's wheelchair soccer, hockey, whatever different things you want to try, that can definitely be a mode of exercise and be beneficial. With the proximal stability, being able to work on reaching or distal mobility, again, having someone else's hands give you some support. And then sometimes compression garments can kind of give you a little bit of core compression that might help with stabilization. Always use lighter weight if you're unable to really perform what you're wanting to perform with that heavier weight. Don't worry about having to go down a little bit. You're still working. It's just that you're working in a better way with less compensation possibly. And then for any of caregivers or those that are assisting with exercise, don't forget about your own posture and mechanics. Definitely don't want injuries to occur when you're assisting others with their exercises. So when you think about, okay, I've got to exercise, what should I really do? Where do I start? And what I think we would say is that start with what's important to you. The specificity of training, of exercise and carryovers is pretty important. So if I want to walk better, I really need to practice walking. Exercises that mimic the activity that you're going to be better at are going to help you with that specific task. And we know that through some nice research that really does show that muscle adaptation or change in muscle strength is really based on specific task training. So think about what's important to you and start there. This is just an example of potentially using different equipment, and a couple of talks that Cure SMA has sponsored actually talked about using resistance bands. And so we kept this in here to just talk about the fact if you do use resistance bands, there are different colors which really do kind of, depending on the color, that correlates to how much resistance that band may have. And typically, the yellow bands have the lightest resistance, green bands have the heaviest resistance. But even if, let's say you have a green band, you can kind of adjust if it's too heavy at resistance for you by just allowing for more slack. And that still lets you work through your range of motion with a little bit of resistance. If you need more resistance, if it's not heavy enough, you pull it tighter and make it a little bit more difficult to move through. And so those can be nice to use. And then the ball that you guys were provided with for this talk, again, is a great addition to kind of your exercise program. I will say a few things, knowing if you've not ever used a stability ball before, is the amount of air that you put into the ball will affect the stability of the ball. If you don't air it up all the way, it's going to be really cushiony, and it actually makes it a little harder to sit on or use. And so sometimes when you're airing it up, you feel like you're never going to get enough air in it. And you're like, how could more air fit in this ball? But really continuing to give some air may help with your ability. It may make it a little bit more stable. If it's still kind of a little too unstable for you, thinking about putting a base of support around the bottom of the ball could be helpful, whether that's putting a couple of weights on either side of the ball. Anything that you could kind of just adjust the ball with to give it a little bit more stability is something you can consider. And then Tina and I have some ideas and some things, but you can be creative as you want with this exercise equipment. And there may be even things on YouTube that you could search for that would be beneficial for using it. All right, so that's just a little bit of an introduction. And now I'm going to let Tina take over, and we're really going to start talking more about some specific ideas. And we're going to start with thinking about that trunk stabilization that I mentioned was so important.
Okay, great. That was a really great foundation for us to start from. So the rest of this is really Leslie and I kind of giving you some core ideas on what to do, as well as give you examples on a range of activities you could do with the ball and resources elsewhere. This is one of my soapboxes, regardless of how strong or weak you are, or you are Leslie or I think we all need to talk and think about trunk stabilization and thoracic pressure, because that's what keeps our spine up. And with the balls, one of the, you see all the time when people sit on the ball for trunk stability, that is something that I tried to do that with my chair, but the ball was too small and I just, it didn't fit on my desk. But that is a really great way to look at trunk stability. But in general, I want to, have us all work together through this. And so, Leslie, there's animation on this eventually as we go through this. But I want to give you an idea of what I always tell people is that the Coke can theory. And the theory behind the Coke can is that when there's a lot of thoracic pressure, for example, in a soda pop can, the pressure maintains the stability, and it's really hard to crack that Coke can. However, if there is any kind of deficit within that, it causes decreased pressure, like for us, example, thoracic pressure, it's easier to collapse that Coke can. And so when we look at the Coke can, what frames the Coke can is really the spine and the ribs, as you can see here. The diaphragm is what regulates the pressure within that cavity. And that's also a muscle, and that helps you breathe, right? So that all of that together kind of builds the pressure. Then you think of the thoracic cavity, which are your intercostals or your ribs. That also creates that pressure and that framework. And the other two things that we can work on when we talk about trunk stability are the abdominals and the back extensors. It sounds a lot easier than it is, because this is what Leslie was describing as isometric stabilization. You're not going anywhere, you're barely moving, but it's really hard to continue to activate all of this. And so most of us don't know how this feels, and so we thought that we'll just have us all go through this process together. So if you click on the first one, Leslie, we'll start with the pelvic floor. And the pelvic floor is one that most of us forget to activate. It just kind of sits there until you really need to go to the bathroom. And then you squeeze it all together. So that's what I want everyone to do now. Squeeze your buttocks together. Squeeze like you really need to go to the bathroom. Okay. Next, we're going to move up to our abs. So now to do that, I want you to bring your belly button back towards the back of your spine. And in doing this, you'll see that you'll get a little bit taller. right? So now your bottom is squeezed, your belly button's pushed back towards your spine. Now you've activated your pelvic floor and your abdomen, okay? Now we're gonna move up a little bit higher and go towards the thoracic spine. And a lot of us are in this crunched position because we're at the TV or at our computers all the time. So now I want you to bring your shoulders back. Now you notice you're sitting even taller, right? Especially for us short people, any inch that we can get, we'll take, right? And so now between squeezing your bottom, bringing that belly button back, squeezing your shoulders back and down, you're sitting nice and tall. And you'll notice even as I'm doing it, I'm even speaking louder. And so to practice that, we go and start talking. You can count to 10, you can breathe, you can sing a song. All of this really activates the entire structure that we consider thoracic pressure or stabilization. Okay. And so to increase the intensity, you could do a few things. You can do it for a longer period of time. I always suggest that when you're doing this, think about doing it during commercial breaks. If you're watching TV at a stoplight, because those are short enough periods of time that makes you concentrate on that. As it becomes more natural, the progression in which you would do this is to add your arms. And then add reaching outside your base of support. That kind of increases the perturbation or the demand of your trunk to hold itself more stable. Okay. And then of course you can add weights and different things, but we always think of exercise in a progression perspective. How can we make it harder as you get stronger? Okay. And then we have a few exercises where Leslie will talk through using the ball that you could do for some of the trunk stability exercises as well.
Yeah, so again, Tina mentioned just that thought of how you keep yourself stable. So even sometimes sitting on this unlevel surface like this ball can be challenging. Once you get yourself nice and upright, you can even challenge it a little bit more. She talked about that progression, maybe leaning forward and back, side to side, just kind of depending on kind of what your comfort is. You do need to challenge it a little bit. Obviously, always be careful that you're not going to fall off of it. You may need somebody standing by, or the reason I shot this in this hallway was so that I could show you if you find a place that has some a hall or a wall or something close by that you can grab onto if needed as you work and challenge yourself. This is another just sitting on the ball, but now we're taking it to the point where we're actually going to add some marching. So I'm lifting one leg, and you can see that even when I go to lift that right leg, I've got a little bit more challenge. It's a little more challenging for me. I'm a little weaker on one side versus the other. And so I have my arms crossed here, but you could hold on to the ball, use your arms and hold on to the ball. If you're too unsteady here, put a chair next to you and hold on to the chair if you need to. Do different things to challenge yourselves in different ways, but still feel comfortable with the motion that you're performing. So those are just some options for sitting and stabilization exercises. Again, staying kind of in that proximal stabilization when we think about abdominal strengthening and hip strengthening. This is just an example of how you can use lying on the ball and then lifting my hips up towards the ceiling, laying on the floor with my legs on the ball, lifting up towards the ceiling. And so the other thing is you can make things challenging in different ways. As I move the ball further away from me, that makes it harder for me to do that. Working on, these are just kind of, lifting up and over different kinds of abdominal exercises. Just different ways you can use the ball. I'm going to go back through this just because here you can see I have my arms down to my side. That's easier than arms crossed across your chest. And then also just the degree at which you lift. If you can only isometrically make those muscles fire and you can't actively lift your hips off of the floor, that's okay. You're still working those muscles. You're engaging them. You're working them isometrically at this point. And so all of those are really great ideas. And Tina has some, the option of a plank, different things. So I'm not sure what did you want to say here?
Oh, I was just adding that, besides the ball, we talk about planks all the time. I think that's a good overall exercise for shoulder stabilization and trunk stabilization. If you can't do a plank, you could do it a plank on your knees. And so it was just another example also for trunk stability from an isometric perspective, taking what you just went through with us on the activating your trunk to really get that strong. So giving you some options to do that is isometric versus the concentric exercises that was in your video.
Yeah, perfect. I also thought about leaning over the ball, lying forward, face down, kind of lying over the top of the ball and working on bird dog exercises where you kind of lift one arm or lift one leg or lift both one arm and one leg at the same time, alternate sides.
Yeah.
Those are all options as well.
Leslie can do that because she's taller. My arms and legs don't touch the ground when I do that.
Good point. So this is a patient who's using the bands that we mentioned and really doing this in a standing position where she may be working kind of ideally on rows or tricep extensions, working on upper body. But I love how Tina really helps us remind us here that don't forget about core stabilization. While you're working these arms, think about squeezing those buttocks, squeezing your quads, and really making yourselves nice and stable while you're doing the motion. And I think that's a huge part of really thinking through exercise. Exercise really takes a lot of thought sometimes when you're really thinking about what you're wanting to work on.
Right. It's really about quality versus quantity. And because of that, remember to put yourself in a good mental space. I think Leslie mentioned before that, motivation is such a big factor. When it comes to exercise, I am not type A. I like to enjoy it because that's the only thing that keeps me consistent. And so just make sure that you do something that is not constantly challenging, because just starting is challenging enough. The picture we have down here, I know that this is a focus for patients who are able to walk, but we also know that just because you're able to walk doesn't mean you don't have difficulty with transitions. And what Leslie and I both notice in some of the difficult things that people who are able to walk still have difficulty doing is getting up out of the chair. And we want to emphasize that that working your upper body strength also contributes to helping with these transitional movements that may typically be seen as for people who are non-ambulatory. And this is a picture of, of what they call a wheelchair push-up. It just requires, similar to what the young lady who's using the bands is doing, a little shoulder depression and stability. The more you strengthen that, that will also help you get out of a chair a little bit better, because I know many of you have more of a difficult time getting out of the chair than walking. And so you end up not sitting down at a restaurant because the chairs are too low, or standing up at meetings because the chair is too low and it's hard for you to get up. So in the name of specificity of training, if this is one of your goals, just make sure that you're working with someone who can break down that task of movement so you can work on those specific exercises that can help improve a functional goal that you may have.
Yeah, it's an awesome point, Tina. This is another example, again, using a resistance band, but now rather than sitting, working those upper extremities, standing, working those upper extremities in a sitting posture. And same kind of thing. Even though you have the capability to walk, and sometimes it's just the challenge of managing all of the different muscle groups can be there. And I think that the biggest thing I would tell you on this exercise is if you watched her do the very first row, she really kind of, again, was compensating in a way that made it easier for her. So she kind of shrugs her shoulders up and to do that row. And then just with my guidance of think about keeping your shoulder blades down, to press them down, now row back, it really changes the kind of the activity that you're working on, the muscle that you're working on. And so that's just kind of another reminder about compensations and how you might need to think through that. Anything else there, Tina?
I know, I think that's great. I mean, I don't think we keep harping on this, but quality, making every minute that you're working out worthwhile, especially for, if you're you're strengthening with weaker muscles. I think that's going to be really important because we naturally, as we fatigue, fall into compensation patterns. And so a mirror would be a good one to have at home. So when you catch yourself doing it, that's where you kind of, now that's your upper limit range. Use your exercise calendar and write that down, because these exercise calendars where you can up that amount of reps that you're able to do without compensations, it's a good way for you to have some way of tracking your own progress. And I don't know about you, but I if I can't see progress, I'm less motivated to spend that extra time doing it. So that may be a good way to do that.
Yeah, for sure. The only other thing, while you were talking, I noticed, okay, so maybe she, out of standing, went to sitting to make it a little bit easier. But now also we've raised the table so that she's not weight bearing and stabilizing through her legs. So she's having to work her trunk a little bit more than she would if her legs were flat on the floor. So there are lots of ways to challenge yourself in different ways. All right. You want me to play this video?
Yeah, we could play this. And so the next couple slides is really focusing on weight shifting. And when it comes to balance and movement, the reason I have all these on here is that it's about weight shifting onto one leg and then moving the other leg. It seems like, whenever you're doing walking or dancing or any of this, you're focusing on the moving leg, but the key to all of this is the standing leg. And so that when we talk about trunk stabilization, we're also talking about pelvic stabilization. So again, when we say stabilization, it's that isometrics that you're really, really working on, squeezing your buttocks together. So whichever leg that you're going to stand on, you're going to squeeze the buttocks, and then when you feel stable, you move the other leg. So here is just giving you some options of doing it. What I'm showing you is, it's to build confidence. You could do this in tall kneeling. As you get more confident with that, you could do it in standing. You could put the waistband up towards your buttocks, but you can also do when you're standing up, and you can see the lady who's doing it as she's standing up. The band being further down by your ankles tend to work your buttocks more than if you had it higher up. It works your quads or your side bottom a little bit more. And some of the other options I have is the other little man here on the right are lunges that you can also do. And even though they're going through the entire range of motion, what Leslie mentioned before is that work within what is safe and comfortable for you. One of the barriers to doing exercise sometimes is having a caregiver or someone there so that you're safe. If you don't feel safe bending as low as that man on the right, then just do a little bit at a time until you have somebody who can spot you. Even for any of us who goes to the gym, we do weights, we still need someone to spot us. So manage your exercises on the resources that you also have. Okay. So that's looking at buttocks and quads. Again, we're going to focus on buttocks a little bit more on this one. So this one, there's a floor exercise that you could do where they're just, clam shells. And again, we focus on our buttocks because in any kind of walking or stability, we really have to activate your bottom in order for you to stay stable. And so these are some examples that you can use if you have the band to do this. The one I'm working on is a clam shell. You can also work on put it behind your leg and work your trunk and kick and do kind of like kick outs. If that's too hard for you, do it without the band. Or you can also work on your hip extensors or buttocks in a sitting position. You can see that what I have is the band around my thigh and I'm pushing down, and that hip extension moment also is something that works my bottom.
Okay. I think when we now kind of moving further down the chain, thinking about how we work lower extremities, also understanding that you're going to have muscles that are stronger and some that are weaker. It's going to be much easier for you, most likely anyway, to work by bending your knee, working those muscles that bend the knee, as compared to trying to straighten the knee. It's a little bit more difficult to do that. And so you may have to adjust the resistance or the different motion that you're actually working through when you're thinking through that. And again, lower extremity wise, using the ball for pelvic stability. I think this is a great idea. And you could even, there's pictures in standing, but there may be other positions that are easier to do, whether it's in sitting, different things that you might be able to do. So anything else there, Tina?
Yeah, no, it's just I thought that was nice since again, if I did this, I may not touch the ground, but Leslie could because she's taller. So um, use different balls, but the balls I think that everyone got sent for those of you who are 5 foot or shorter, take this with the word of caution.
Be balancing on top of it. Be impressive.
Yeah.
These are just a couple of videos of doing wall sits or wall squats and things to kind of think about as far as kind of positioning. There are ways that you can make it a little bit more challenging and a little bit more easier. You can see on the video on the right, have my arms crossed across my chest, going much deeper down into that squat. And so that's much more challenging versus having hands on my legs, going a little less deeper. Again, I'm in a narrow kind of hallway, so I can actually use my hands if I need to help with that positioning or with that motion as well. Or if you don't have a hallway like this, you could put a chair in front of you and kind of stabilize yourself on the chair to help with getting into that deeper kind of squat. I love, Tina added this in, that add arm exercises as this gets easier. So as you go into a squat, as you start to lower, you might be able to do a bicep curl, work on your biceps while you're getting, getting to bang for your buck, right? I mean, that's a great idea.
If you're anything like me, I have a hard time whenever it comes to, these kinds of things that I'm a cardio person. So anything that causes me to have to do isometrics or hold is difficult. So one of the things that helps me on this, there's apps that you can look at that's, has interval training. If you look up interval training, you could set 30 seconds, then 30-second rest, or 30 seconds, 1 minute rest. So there's a timer always going. And so then you could do this at different heights. And, when we talked about specificity of training and getting up out of the chair, you can work on the range of motion that is the most difficult for you and have those isometric holds. And so that's one of the things I wanted to add there. And the whole arm thing, I feel like it's a nice distraction to have some body part moving whenever you're trying to hold, because otherwise it's mind over matter sometimes, and your mind is thinking your legs are killing you. But if you distract yourselves with arm dances or something, it may make this more tolerable. But I really like the wall sits. And Leslie, that's impressive on how low you can go with the wall sit on the ball.
I only did like one of them, so All right, let's see if I go forward. I mentioned early on balance, and no big videos here, but really just for you to think about it. I mean, balance can be something as simple as standing on one leg, or it may even be standing on both legs and being challenged by throwing a ball with somebody, or working dynamically as you're trying to stay stable and upright. So you may need to start with what we would call static balance, where you're just trying to be nice and still and controlled. But as that starts to get easier, you add dynamic movements, meaning maybe you start doing bicep curls, you work your arms a little bit, you throw a ball, you stand on unlevel surfaces. Always, though, if you make sure that you've got something or someone close by, just to prevent a fall. And then working on your endurance of that balance. So as it starts to get easier, make yourself hold it for longer periods of time. And then things like closing your eyes can make it more challenging. We use our vision as well as our feel for us to be able to hold a balanced position. And so you take one of those away and it makes it a little bit more challenging on your body. Okay.
Okay. I wanted to give you some ideas of different types of exercises that have really been proven to be effective for balance. And the truth is awareness. Earlier when we talked about the trunk stability and your, squeezing your buttocks and everything else, when you're standing, what Leslie talks about with static standing, it may look like from the outside you're not doing anything, but mentally you're doing everything. So when you start with static standing, you think about first, what's your feet doing? Does your feet feel the ground? Push towards the ground, get that big toe and push down into the ground, so you're grounded. And then you kind of move up, and if you keep thinking about those, you're actively engaging these muscles that really give some neuromuscular input for muscles that maybe haven't been working. So now that you're on treatment, you want to focus on something that is actively engaging your mind and muscle connection. And so that being said, my friend Tiffany here has a great series of what they call Atago exercises for balance, and she's so calm about it. She has 4 videos or so, and it varies from trunk stability and sitting all the way to standing, all the way to active strengthening with weights and weight shifts. She concentrates a lot on what we talked about, which is quality of movement. And so here's the website that if you are like me, you just need somebody to tell you what to do in regards to exercise, this is something that you could connect to. The other one I wanted to mention is Tai Chi. So when Leslie talked earlier to you about balance and shifting that weight, the reason why Tai Chi has been shown to be so effective for balance for lots of different disease groups, including geriatrics, Parkinson's, etc., is because of these slow, deliberate movements that are entirely based on shifting your weight. You're trying to think about your weight going over your ankles. Are you activating your trunk, your pelvis, all of that? And then, of course, for those of you who want to be fantastic dancers, it all is about weight shifting. So if you can shift your weight back and forth, you really move that's the kind of the pattern when it comes to dancing. So at the end of the day, balance and strengthening is a lot about weight shifting. So there's that.
That's awesome. So we have as far as cardio, we gave you lots of ideas about being able to swim or walk or do different things, but you can use upper extremities to do cardio as well. And so Tina, I'll let you kind of talk through some of the cardio.
The whole point in this is that you can do cardio with anything we showed you. If you stick to what Leslie showed you before with the amounts of reps, cardio is just increased reps, less weight. Use pulleys and different systems to get your heart rate up. So really, any of these things that we showed you, you could do it with a cardiovascular endurance in mind. And of course, while you're doing this, you got to remember trunk, shoulder, and pelvic stabilization.
So we've given you some ideas. We've talked about why it's important, but what helps you set goals and what helps you stay consistent? And obviously that is different for every single one of us attending this talk. What motivates each of us is very individual. And so kind of, making it fun, thinking about, if you're a social person, doing something with a community or with adaptive sports. If you don't like to be around people, finding ways that you can still make it fun for yourself. I think having some discipline and understanding what that means, maybe that's setting a plan, maybe that will then in turn help create a habit, or if you need those support groups, or maybe you need someone that you're being held accountable to. Maybe you need an exercise buddy that, Tina, I need to be able to tell you I'm going to work out today, and you're going to check in with me tomorrow and ask if I worked out today. And that's okay. Asking for help in that way is perfectly fine, and really would encourage you to do so. But also think about your goals. Obviously, if I wanted to say I want to run a marathon and I can't run 2 feet today, it's probably outside of my my goal for any kind of short-term goal for sure. Maybe a really long-term goal, and that's something that, again, thinking about short-term and long-term goals and then modify them as you reach them and keep working forward. Tina mentioned an exercise tracker or an exercise kind of log. And I think these are great. This is one she shared that I think is really nice. And basically day to day, you can mark on here whether you worked on cardio or strength, how long you worked on it, how many reps and sets you did, and then even tracking how intense you worked and really understanding how that might change day to day. And I really like what she said in that this may be motivational itself. If I see that that my my duration and my reps and sets are continually going up and up and up and up and up, that may give me some self-motivation to keep doing what I'm doing. It shows that it's something that's working.
I think it's sometimes hard when you're doing it on a regular basis to see your progress. And so it's nice to have something that tracks it. When we think about applications and motivation, I think about having a smartwatch, and somehow I linked up with some of my friends and I could tell whenever they've worked out, and I was like, oh, Leslie's finished her workout. And then I make the point of saying, good job on your workout. Just because we're human, and it's nice to be acknowledged when it was hard enough for us to start that exercise or activity. Those are the little things that technology gives us the benefit of supporting each other, whether it's physical, which is harder these days. Virtual is huge because exercise is very mental. It helps your mental health, but it also takes knowing yourself and your mental capacity to get started and continue doing it.
And then I think the last thing, we just want to make sure that we mention that there are some considerations from a medical perspective, and that there are a few potential risks, and that exercise, depending on kind of your current status, though, really you could have a potential risk for increased injury. Depending on kind of your bone fragility, there may be a little bit of a fracture risk. And then fatigue, I think for those for the population we're talking with today, which are patients that are able to walk, is that fatigability is probably one of the biggest things that might increase your potential for a fall or for different things. And so just understanding that those risks are there and how you'll minimize those, because don't let that scare you at all. The benefits are numerous from an exercise standpoint. I mean, Tina just touched on even the mental impact that exercise has on our mental health. It's huge, and so it's really important to keep all of that into consideration. All right.
Oh, this one I just left in. If anyone's in the California area and you're around, we are doing some exercise testing to work on methodology and understanding exercise better for people with SMA and other neuromuscular diseases. So if you're in the area or you feel like being in the area, please just reach out to me. We'd love to have you and do some exercise testing with you.
I feel like being in the area. Can I come see you?
Yes, please. We need controls. We'll have an exercise party.
Okay, sounds good.
Oh, I just lied.
Sorry.
No, I
clicked off.
I'm sure many of you see this, but I never get bored of seeing it. This is Mom's a Zumba instructor, and they've hooked up her son really nicely so he gets to dance with her. So, think outside the box. If there's a will, there's a way. So let us and your therapy community help you adapt to help you do whatever it is that you would like to do.
I love this one. That's awesome.
I know, I love it too.
All right.
Well, thank you so much, Tina and Leslie. So it looks like I know we're getting close to the top of the hour, but we do have time for just a couple of questions that have come in from our community. So let's see here. Our first question is, have you encountered or heard of type 3 individuals toe walking to compensate for proximal weakness? Is this something you would try to work on or allow your child to do?
Yeah, Tina, I'll start. I actually have several patients that, well, not several, but and one in particular that is a very strong walker.
Yeah,
I mean,
I know who you're talking about.
Yeah, he swims competitively. really, really strong, but does have plantar flexion contractures, and so walks on his toes. And this was something that we struggled with early on, in that from an intervention standpoint, you know, whether or not we should have done surgery early on or not, those different kinds of questions came into play. This was all before we had disease modifying therapies, and so it's a little bit of a different story now. But yes, that does happen, and I think that is part of it. Being up on the toes, kind of because of some proximal weakness, just helps with stability and balance when walking and propelling forward. It's a tricky question, and I'd love to hear what Tina says, because it's one of the things that I think therapists struggle with. I kind of think about, if you asked me if I needed to develop a seating system for someone in a wheelchair, I can make them as upright and beautiful and posturally beautiful as possible. But does that mean they're functional? Maybe I take away their function if I put them in a better position. And so I kind of go at it in that concept or frame of mind. If being up on toes makes you more functional, makes your mobility better, easier, more efficient, I don't know that I would change it. And that's kind of where I come from, Tina. I don't know what your thoughts are.
I entirely agree with you. I'll take the first one from the functional piece of it. I think that should be first and foremost the conversation. So the individual that you're talking about, who's already on his toes and has actual contractures and not tightness, I really would look at it as a functional decision making on that. I refer back to my days working in cerebral palsy, and even in decision making with Duchenne muscular dystrophy, when people go up on their toes, right? What I've seen, when I was early on in my career, I remember seeing a kid who had cerebral palsy, and similar to what Leslie was mentioning, that you can make them look perfect, right? If you get, say, you do an Achilles tendon release, and now they're flat on their feet, but they don't have the proximal strength or quads to keep themselves upright, what you just did is took away their ability to walk. And so before this decision's made, I think there's a lot, it takes a village. And so I say consult with your therapist, who will have a very functionally based focus. Talk to an orthopedic surgeon or doctor, so that you can weigh the pros and cons, because any kind of change in length is going to require more strength. And if you don't have the ability to strengthen, or you don't have that strength already, you may lose that skill. And I would hate to see anyone lose the ability to walk because now they've just lengthened their Achilles tendon. And also, that being said, for those who are, they notice their kids, or they are getting tighter at their ankles, everyone should think about stretching the ankles, and we have resources for that. And have your therapist check it, because catching it while it's tight and there's still mobility is a lot easier than once there's a fixed contracture, because there's really no way to fix a fixed contracture but surgery. And so try to catch it beforehand, and there's mechanisms to conservatively manage that via stretching, nighttime braces, etc., that may prevent you from having to make a tough decision.
Thank you. And we actually had a question come in about contractures. And I know you kind of covered a little bit, but what are your thoughts on massage or other manual therapies for contractures and contracture prevention?
I mean, I think that's a really good question. I think the reason why contractures are such an enigma for us is because we define it a little bit differently. When I think physical therapists, when we think of contractures, we think of a hard endpoint that's not moving. And so when I say a hard endpoint, that means, like, for example, you move your hand through a range of motion, and at the end of that range of motion, it's like right now, you can see my hand. There's a little bit of flexibility, so it's not hard. But if you have a true contracture, you push against it. It's like two bricks pushing against each other. That's a true contracture. If there's some give or flexibility, that means it's not truly contracted. There's variations of tightness. And so when you're talking about variations of tightness, there is ways to manage that via stretching and to increase the flexibility of the muscle. And when you talk about muscle health, if there is more flexibility stability, it's easier for muscles who are weak to activate and move. If there's that extra tightness, now you kind of add a resistance to the ability to function. There was a study that's done, I think, by Kate Carroll or Katie Duvall in Australia that looked at massage, and they looked at it in I think Duchenne muscular dystrophy, not necessarily SMA, but they did find that massage, like a light massage and petrissage, was helpful for function as well as range of motion. Whether or not it's preventative is a whole nother question, but we encourage it rather than discourage it, I guess.
Yeah, I'd agree. I think the benefits can be there. The thing I would say is that, so if the massage does help with, softening tissue enough so that you've got new movement or whatever the case may be, working through that new movement after you've gained movement. And that's the same thing with stretching, is that it's kind of, keeping work through whatever range you have, whether it's stretching or massage, to try to maintain that range and or improve your range would be. So I think massage would be a great addition to an exercise program, or to stretching or positioning, bracing, whatever you're using from a contracture standpoint.
Yeah.
Thank you. And then I think we have time for just one more question. Someone wrote in, although I can walk, I cannot get on and off the floor, nor can I sit to stand from low surfaces. Are these ball exercises as effective on a bed?
So I'll just, if you're able to get on and off with the ball on the bed, I think that's fine. I will say the only thing that I would stop to kind of think about is actually your ball may be a little bit less stable on the bed, because the bottom of the ball is not sitting on a very hard surface. I don't know, it kind of depends on the firmness of your bed, different things like that. But from a standpoint of, if you're like, for instance, the bridging exercise where I had my feet and my legs on the ball and I was lifting my hips up, definitely could do that on the bed. I mean, and just have the ball under your feet and do your hip, your bridging under, or your bridging with that one. That would be perfectly fine. So it just would, the stability of the ball may be affected if you're on a different surface. And I do.
The ball. Oh,
go ahead.
Oh no, I was just gonna take a little different perspective. Instead of focusing on the legs, I would put the ball on the bed, and if you're having difficulty getting out of the chair, more than likely you're using your arms, and so I would use it as an arm exercise to work on the push downs to help you push that, that initiation of getting out of the chair. That's really what I would put the ball on the bed for. But it all depends on your bed and depends on your size. I couldn't even reach the ball if it was on my bed. So it just there's so many biomechanical factors that matter.
The thing I would say though, if that's a big limitation, getting off of the floor, those kinds of things, working on sit to stands on various heights of things. And so maybe you try to find a surface that's a little bit taller than a typical traditional chair and work on sits to stands from that higher surface. And then as that gets easier, start to work on lower surfaces to try to build up some endurance or strength to make that function or that action a little easier for you. So that's just another additional thing I would say to that question.
Yeah. Yeah, I mean, I would say combine your arms with it, just because I have yet to see someone who has difficulty getting out of the chair without using their arms. And so if anything, then it allows you to get up without laying on a table. And maybe it gives you better access to some places to go eat instead of only going to restaurants that have high top tables.
Yeah.
Great, thank you so much for your feedback and all of these wonderful answers. Thank you again for your time today presenting. We're so grateful for all of our attendees as well. You're going to be receiving an email that has a survey link, and we'd love to hear your feedback. And we're also thankful again for the incredible support from our presenting sponsor, Biogen, for making the physical therapy webinar series possible. If there's anything that we can do for you, or if you have any additional questions, please email us at communitysupport@curasma.org. Have a great day, everyone, and thank you so much again, Tina and Leslie.
Thank
Thanks for
you.
the opportunity. Happy holidays.